Good evening, you're watching Left, Right and Centre. Our top story. In a massive appeal to citizens, the Prime Minister has said that India faces a massive challenge because of the coronavirus. In substantive terms, this is what he wants us to do. Leave your homes only if it is necessary. Do your work from home. Government workers, medical workers and some others have a role, but everyone else, society must isolate itself. In our family, said the Prime Minister, whoever is a senior citizen above 65 for a few weeks must not leave their homes. And now he's repeated this twice. He said, I am asking every citizen for some more support. A Janata Curfew, a curfew for the public, by the public. In 2 days, on the 22nd of March, in other words, Sunday, from 7 a.m. to 9 p.m., follow the Janata Curfew. No one will come out of their homes or be on the streets. Stay in your homes. This is in the interest of the nation. This will be a symbol of the nation, and perhaps most significantly, this will prepare us for future challenges. State governments must ensure this. In the last 2 months, lakhs of people in hospitals, airports, the Prime Minister said, have been working non-stop. They're serving others, and therefore at 5 p.m. on Sunday, go to your doors or balconies of your homes for 5 minutes and thank these people by clapping, ringing bells. There will be sirens as well for that period of time. Now, it may seem as some sort of a bizarre call to a ceremony on Sunday when there has been this big demand for a lockdown, but in fact, it could be seen as a precursor or a prelude to a full-fledged lockdown should that be required. What the Prime Minister did say is that this Janata Curfew exercise on Sunday was something which could help us in the future. Could this be interpreted as some sort of public training to encourage people to stay at home, because that's something that may be required in the future? We certainly hope it isn't, but it could be required in the future to ensure that the COVID-19 outbreak doesn't move to the next stage, and that stage is community transmission. What is community transmission? That's when the virus moves into the general public, and therefore identifying the source of the particular infection becomes difficult, if not impossible. So we'll be looking at various aspects of what the Prime Minister said, including how there will be an economic package in the days and weeks ahead. But let's listen to some of the key points that Prime Minister Narendra Modi had to say.
प्रत्येक देशवासी से एक और समर्थन मांग रहा हूं। ये है जनता कर्फ्यू। जनता कर्फ्यू यानी जनता के लिए, जनता द्वारा खुद पर लगाया गया कर्फ्यू। इस रविवार 22 मार्च रविवार को सुबह 7 बजे से रात 9 बजे तक सभी देशवासियों को जनता कर्फ्यू का पालन करना है। इस जनता कर्फ्यू के दरमियान कोई भी नागरिक घरों से बाहर न निकले, न सड़क पे जाए, न मोहल्ले में या सोसाइटी में इकट्ठे हो, अपने घरों में ही रहे। साथियों, 22 मार्च को हमारा ये प्रयास हमारे आत्मसंयम, देश हित में कर्तव्य पालन के संकल्प का एक मजबूत प्रतीक होगा। 22 मार्च को जनता कर्फ्यू की सफलता, इसके अनुभव हमें आने वाली चुनौतियों के लिए भी तैयार करेंगे। मैं देश की सभी राज्य सरकारों से भी आग्रह करूंगा कि वो जनता कर्फ्यू का पालन कराने का नेतृत्व करें। आप ये भी कर सकते हैं, हर दिन 10 नए लोगों को फोन करके आप इस वैश्विक महामारी के संबंध में नागरिक को करने वाले काम, जनता कर्फ्यू की बात उनको समझाएं, उनको बताएं। कोरोना महामारी से उत्पन्न हो रही आर्थिक चुनौतियों को ध्यान में रखते हुए सरकार ने भारत सरकार के वित्त मंत्री के नेतृत्व में, फाइनेंस मिनिस्टर के नेतृत्व में सरकार ने एक कोविड-19 इकोनॉमिक रिस्पांस टास्क फोर्स इसके गठन का फैसला लिया है। ये टास्क फोर्स सारे स्टेक होल्डर से नियमित संपर्क में रहते हुए, फीडबैक लेते हुए, हर परिस्थिति का आकलन करते हुए निकट भविष्य में फैसले लेगी। ये टास्क फोर्स ये भी सुनिश्चित करेगी कि आर्थिक मुश्किलों को कम करने के लिए जितने भी कदम उठाए जाएं, उन पर प्रभावी रूप से अमल हो। निश्चित तौर पर ये महामारी ने देश के मध्यम वर्ग, निम्न मध्यम वर्ग और गरीब के आर्थिक हितों को भी गहरी क्षति पहुंचा दी है। संकट के इस समय में मेरा देश के व्यापारी जगत, उच्च आय वर्ग से भी आग्रह है कि अगर संभव है तो आप जिन जिन लोगों से सेवाएं लेते हैं उनके आर्थिक हितों का ध्यान रखें। मैं देशवासियों को इस बात के लिए भी आश्वस्त करता हूं कि देश में दूध, खाने पीने का सामान, दवाइयां, जीवन के लिए जरूरी ऐसी आवश्यक चीजों की कमी ना हो, इसके लिए तमाम कदम उठाए जा रहे हैं। ये सप्लाई कभी रोका नहीं जाएगा। इसलिए मेरा सभी देशवासियों से ये आग्रह है कि जरूरी सामान संग्रह करने की होड़ न लगाएं। आप पहले जैसे करते हैं वैसे ही सामान्य रूप से ही खरीदारी करें। पैनिक बाइंग ये कतई ठीक नहीं है, उसको न करें।
Well, joining us now to discuss various aspects of what the Prime Minister said, Dr. Naresh Trehan, Chairman and Managing Director of Medanta, the Medicity. We're also joined by Dr. Naveen Dang, founder of Dr. Dang's Labs here in Delhi. Dr. Rajesh Parekh, Director of Medical Research at the Jaslok Hospital in Mumbai. And we're also joined by Vikram Kirloskar, the President of the CII. Thank you very much, sir, for being with us. Dr. Trehan, let me come to you first. I think what was very interesting about the Sunday announcement is that this will prepare us for future challenges, is what the Prime Minister seemed to suggest. That we keep using the word lockdown. Perhaps in the Indian context you can't do that instantly, but this, I would say, is an effort at public training at a mass level. There could be something more substantive in the days and weeks ahead. Do you see this as a smart initial move?
So if you look at it overall, it was extremely well crafted communication for the nation and the public. He went direct to the fact that this is a dangerous situation that we are facing. It's an invisible enemy and we must all prepare for fight against it, like almost like a battle cry, which was excellent because he gave the whole details of what is expected of a citizen, including the details, and I'll not go into it. But the next thing that he said was that he said that those people who are elderly and children need to be protected, and it's every citizen's responsibility to abide by what they need to do to prevent the spread of this disease. So that was very well communicated. The second thing he said, which was also very important, is to increase the resolve and the enthusiasm of essential service providers like doctors, nurses and firemen and policemen and so on and so forth, actually to appreciate them and make the public appreciate them, which was very important, that those people who are putting their lives on the front line actually get this kind of booster to say, yes, we are committed to fighting this enemy.
Yep.
The third thing which was very nicely said about was the economic hardship that is coming, and the fact as the people who are on the, of poorer means or less means are going to suffer the most. So he made an appeal to all of us that please take care of them so that they do not suffer any deficiencies in their ability to take care of their families. I think it was very sensitive and very nicely done.
Yeah.
And what I appreciated the most was that he actually stayed at the human appeal and stayed away from the technical parts of it, which we keep discussing on TV about the testing having to be increased. What are we going to do when the pandemic comes? So these are all things that I think very well done, and I must say that hats off to the guy.
Okay. Dr. Parekh, I found the bit about the 5 p.m. celebration on Sunday interesting. A lot of people would say, oh, it's strange. Why would you want to ring a siren or ring a bell or whatever it is, go to a balcony at 5 p.m. for 5 minutes? It seems to be so much of a tamasha. But if you look at it, it's actually something which people may look forward to doing after spending the entire day at home and not going out at all. Because the Prime Minister was very clear in his instructions, don't do this, don't step out. On that one day, you're going to be staying at home. Only at 5 p.m. come out and celebrate the work that fellow citizens have done. Is that also not part of the exercise of training people to stay at home, to at the end of the day have something to look forward or something different to do? It's in a sense getting people involved and training them for what might be coming in the future, who knows?
Sure. As an exercise in itself, also for its symbolism, it's well taken by those of us who are healthcare workers and at the forefront of this battle. But you know what would be really nice is, we don't need people to clap. We don't need people to applaud us. This will pass. But, in our country, more than any other country, nurses, doctors, low-level healthcare workers get assaulted. Something doesn't work right. A patient with an accident is brought into the hospital. The doctors work sometimes 36 hours at a stretch to save the person's life, and that person doesn't survive. And every now and then, you read in the newspapers that doctors are being assaulted, sometimes brutally. I think it would be nice if the Prime Minister, in his next address, said that, yes, that's fine. You may applaud, you may not applaud, but
so I take your point, Dr. Parekh, but we need to be respectful for the incredible work that our healthcare providers, people like you, provide our citizens. But I'd just like to focus a little bit more on what the Prime Minister had to say.
Sure.
Dr. Dang, he did not focus on testing at all. And at some stage, would you not like to have seen him focus on that? The fact that you've got people still standing in line and saying, look, I want to be tested, going to a government hospital, they may not have the infection, and then while they are in line, being infected potentially. Or even those who have to wait for the results of their tests are sometimes put in an isolation ward with 6 or 7 others in government hospitals. They may not have the infection, but they're waiting 3 days for the result to come in and could be infected because somebody near them is infected. So are these not basic things that we need to do now? Testing is so important. And I know that the government is speaking to people like you and other private agencies, but should this not be moving faster? Testing.
Thank you, Vishnu, for asking this pertinent question. But please remember, this very gracious address and a very intelligent and smart address by the Honorable Prime Minister was a non-technical address. This address was meant for the common masses, where he wanted to convey the importance of the disease, the importance of this problem, and convey a message which the common man will understand. Yes, the technical aspects are there. I fully agree with you and endorse the fact that testing is required, more testing is required, the patients are suffering, they're facing a dilemma, but the government is doing its best as far as the government hospitals are concerned, private sector is being talked to, but still nothing has happened. But I feel that this was maybe not the right forum for him to have spoken about it. Different task forces have been created. Niti Aayog is working on it. ICMR is working on it. And I'm quite sure behind the scenes, the Honorable Prime Minister would definitely be giving them a push that please, I have committed to the nation that your health is in the hands of the government, your well-being is in the hands of government, so move fast and move ahead, and let's see this, what he has promised indirectly and directly should be implemented. I'm quite sure that after today's address, everything will move in a fast-forward mode and will get soon addressed soon.
Okay. Vikram Kirloskar, President of CII, we spoke earlier on in the day, and you were hoping, we were all hoping that the Prime Minister does come out with some statement on what the government needs to do to help all of us in the economy. Were you hopeful of more than just a statement of a task force having been formed? Did you want something more substantive to have been mentioned at this stage?
No, I believe a task force being formed is enough right now, because I don't think he can make any detailed comments in this kind of a speech. As my previous speaker just said, this speech is for the masses, and it is really to push for behavior change. You know, I truly believe, I agree with him fully, that we require a change of behavior to really overcome this virus and overcome the kind of calamity we are in. We require resolve, we require restraint, we require all citizens to behave sensibly and responsibly. That's the only way we can take this on. And yes, maybe a 5 o'clock clap is symbolism, but symbolism is also very, very important.
Yes.
It acknowledges, it's like respect for the people. You know, I respect what you are doing. I truly understand what doctor said, and I agree with him, but this is like, I respect these workers. In our communications from CII, I've also requested very similar things, and especially regarding the small and medium scale and the small service providers to us, like the daily wage owners. How can we protect them? It is important that we protect them because they are the backbone of our manufacturing industry. And we've also suggested to CII members, please look at your compensation across the board, including senior level compensation, lower it if required, but try to protect these people who are our service providers, who are at the lower end of the ladder, because we need them as we get out of this crisis. Yeah. I truly appreciate the Prime Minister's speech. I think it gives me a lot of confidence because it's trying for a behavior change where we build up trust in the nation.
Yeah, Mr. Kirloskar, you know, he was very, while speaking about behavior change, which I do understand was perhaps the larger effort over here, he was very direct. He didn't beat about the bush about the nature of the danger that we faced. Neither did he beat about the bush about the economic consequences we may face. And I wanted, Mr. Kirloskar, a couple of more points from you on that. Let me just see what he said. He said, our economy has been severely impacted. The government has decided to create a task force, an economic response task force. They'll talk to all stakeholders, etc. Middle, lower and poor sections have been badly affected. Appeal to the richer classes that you must think about those who are less well off. Don't cut the salaries of your staff. They have to run their families as well. They have to save their families as well. So if they don't come to work over the next couple of days or whatever it may be, don't punish them. I think that was very important, that those who work for us in our homes, they have their families to run. The Prime Minister said this. Don't cut their salaries. In fact, look out for them. Mr. Kirloskar, was this not a really critical part of his overall message?
I think it's a very appropriate message that he gave. The economic, you know, the understanding that we are in a bad economic shape was also very, very important. See, I feel for me the message is as follows. We have to get through this crisis. As we get through this crisis, we have to look after everyone, but we have to also survive after the crisis. Please understand, you know, we cannot have bankruptcies after the crisis. And what I'm looking for this economic group headed by the finance minister to do is come up with plans or come up with ideas, take suggestions from, you know, the various stakeholders to ensure that industry, business, agriculture, services, you know, whatever, the whole economy is able to get back to health.
Right.
After the crisis is over. And it's important that these skilled people who we have developed over the years, we have nurtured over the years, they are not they are taken care of right now. It is important.
Yep.
Because they are going to be part of the recovery.
Sure. Dr. Rajesh Parikh, just to focus on the medical aspect of this, he said that people above 65 years of age shouldn't be stepping out. In fact, he repeated this. He said, I repeat, people above 65 years of age, my appeal to you, do not step out. For the benefit of our citizens, people watching this program, why are people above a certain age most vulnerable to COVID-19?
Okay, if I may share a chart with you.
Yes, please.
A data chart, and I'm not sure if this is
It's visible. Go ahead. Yes.
All right. So this is a pyramid based on over 44,000 patients who were seen in China. And this data will explain what we see over here is that 81% of patients were mildly affected. That's kind of reassuring. And then you see another 14% who were severely affected.
Right.
And then you get another 5% who were critically affected. But of course, at the base, there's a large number of patients not included in this data who are undetected, who have not been seen. Now you come to the top of the pyramid, and that is 2.3% of patients died. The vast majority of this 2.3% are people above the age of 60. So the disease is particularly ferocious on the elderly. There are medical reasons for that. We could go into that if time permits. But it's important for us to understand that what the Prime Minister was saying was based on solid data, that the elderly are vulnerable. Now, if I may have half a minute,
yes.
I'd just like to elaborate on your previous question, and that was about the testing. And here too, I have data for you. And this is another data chart. Is this clearly visible?
Yes, go ahead. Carry on, sir.
All right. So if you look at this chart, you're seeing two graphs, one of the South Korean model and the other of the Italian model. The Italian model was low on testing, but strong on lockdown. The South Korean model focused on testing, and actually there has been no lockdown. So if you look at these curves of the South Korean population, they started testing early, and they have now almost plateaued out. They were getting less than 200 cases a day. They never had to go into lockdown phase. The Italians delayed the testing. They got into testing much later, as a result of which the number of cases has escalated this high, and they have gone into lockdown. So, of course, staying at home, isolation are very important, and the Prime Minister has very clearly, very lucidly explained to the citizens the need for us to be at home. Most Indians respect their elders. So I thought that was a nice thing to say, that stay at home, the elderly are vulnerable, but we need to have more testing. Lockdown doesn't work as well as testing.
That's the critical point. Dr. Trehan, I need to belabor the point because it's an essential point. It's a point that saves lives. What Dr. Parikh was talking about was the importance of testing, how testing was important in the South Korean context. They've actually almost won the battle against COVID. Would you like to add to that? Home testing, for example. When people come to our homes and people are not exposed when they go out, should there not be some sort of a community service of trained testers who come out, take swabs, and then provide people with results? Otherwise, you have people in hospital, they may pick up different ailments over there.
So, you've talked about something very important which was actually practiced at the breakout of swine flu. And Dr. Dang can vouch for that they trained many people who can go home, pick up samples from home. They're trained safely. This virus is a little more virulent than the previous ones, so there is more protective gear required, but that's where the safest way would be to pick it up from home, because otherwise when there is crowding at testing centers, there is always this danger that that odd one person who has it can spread it to the rest of the people. So it's very important. And I think that the beauty of this Prime Minister's speech was that he left the financial to the financial task force, and he's left the technical parts of how we're going to move forward to the technical task force. And they're all there. So I'm saying that this testing has to increase, because that's the only way we find out where the pockets are. Otherwise, we are flying blind, which is very dangerous at this stage. So we have this window, we must gear up, and I think in the next 24-48 hours, there will be a solution where recognized, well-run, certified labs will be allowed to do the testing. It's being worked out right now, and I hope that will happen. But more importantly, we are also ready for phase 3. Phase 3 is where a large number of people will get sick and will need to get hospitalized or quarantined, and we have to have all these facilities ready. So I think we are halfway there. There is a lot of discussion going on. Everybody, the private and the government sector are working elbow to elbow to actually provide the services when they are needed. And I hope we won't get that kind of explosion, but what we get, I hope we'll be able to take care of it effectively.
That's a very key point, because I think it's almost...
And the fact is very clear that with age, immunity goes down.
Sure.
And with diabetes and other concomitant diseases, so those are the vulnerable people more so.
All right, we're going to come back to this discussion. I need to take a short break. We are discussing what Prime Minister Modi said in his address to the nation on the COVID situation, what he wants all of us to do in order that millions of Indians, more than 1 billion Indians, 1.3 billion Indians, are safe in this country. Stay tuned. Welcome back. You're watching Left, Right and Centre. Let's bring you a few more excerpts, important ones, of what the Prime Minister has said in his 8 p.m. address to people across the country as India faces a crisis, as indeed the globe, perhaps our greatest crisis ever, the COVID-19 pandemic. This is what the Prime Minister expects us to do.
प्रत्येक देशवासी से एक और समर्थन मांग रहा हूं। ये है जनता कर्फ्यू। जनता कर्फ्यू यानी जनता के लिए, जनता द्वारा खुद पर लगाया गया कर्फ्यू। इस रविवार 22 मार्च रविवार को सुबह 7 बजे से रात 9 बजे तक सभी देशवासियों को जनता कर्फ्यू का पालन करना है। इस जनता कर्फ्यू के दरमियान कोई भी नागरिक घरों से बाहर न निकले, न सड़क पे जाए, न मोहल्ले में या सोसाइटी में इकट्ठे हो, अपने घरों में ही रहे। साथियों, 22 मार्च को हमारा ये प्रयास हमारे आत्मसंयम, देश हित में कर्तव्य पालन के संकल्प का एक मजबूत प्रतीक होगा। 22 मार्च को जनता कर्फ्यू की सफलता, इसके अनुभव हमें आने वाली चुनौतियों के लिए भी तैयार करेंगे। मैं देश की सभी राज्य सरकारों से भी आग्रह करूंगा कि वो जनता कर्फ्यू का पालन कराने का नेतृत्व करें। आप ये भी कर सकते हैं, हर दिन 10 नए लोगों को फोन करके आप इस वैश्विक महामारी के संबंध में नागरिक को करने वाले काम, जनता कर्फ्यू की बात उनको समझाएं, उनको बताएं। हालांकि कुछ देश ऐसे भी हैं जिन्होंने आवश्यक निर्णय भी किए और अपने यहां के लोगों को ज्यादा से ज्यादा आइसोलेट करके स्थिति को संभाला है, और उसमें नागरिकों की भूमिका बहुत अहम रही है। बड़े बड़े और विकसित देशों में हम इस वैश्विक महामारी का व्यापक प्रभाव देख रहे हैं, तो भारत पर इसका कोई प्रभाव नहीं पड़ेगा, ये मानना गलत है। और इसलिए इस वैश्विक महामारी का मुकाबला करने के लिए दो प्रमुख बातों की आवश्यकता है। पहला, संकल्प, और दूसरा, संयम। संकल्प और संयम। इस तरह की वैश्विक महामारी में एक ही मंत्र काम करता है, हम स्वस्थ तो जग स्वस्थ।
Let me go back to Dr. Trehan at this stage. Dr. Trehan, the Prime Minister began by saying that he needs the next few weeks. He wants us to help him and help ourselves over the next few weeks. Why a few weeks? How is that central in the fight, this time period against COVID?
See, this is the natural history of this particular epidemic or now pandemic, that it starts from one focus, and in our country the focus came from foreigners who traveled to India from Italy, from Iran and some other countries, but mainly a lot of it came from Italy, and Indians returning from overseas from these infected countries. So first we discovered it in those people, then in their contacts who were in the immediate exposure, like the families or friends, like you heard the famous story of somebody who returned from Italy and gave a party for a birthday party for the child, and many people were exposed and all that. So that's how it usually spreads. That's why we call it phase 1 when it's imported into the location. Phase 2 when it spreads, look with the contacts of the people who first started spreading it. And that is the time when you can contain it, because if you judiciously track every contact and try to contain them, quarantine them, you may be able to contain it. But then the next phase comes, which we are in right now, that whole idea that we have reached a critical mass of people who have gotten infected. Then it multiplies very rapidly, because one super spreader is the guy who may have very bad pneumonia or something like that he can spread it like wildfire. So that's why we are at a stage where we may have a window for the next week or 2 weeks where we can stop this rapid spread. That's why the whole appeal is that every person becomes a corona warrior. We can collectively actually contain it hugely, because if India suffers the same fate as Italy did or Iran did, we would have mayhem, because we have 135 crore people. So that is why the biggest worry is that we will not have the resources to handle it quite. So it's imperative that we stress it again and again, what people have to do. And this, like I said, today's delivery by the Prime Minister will help to drive the point home that we have to behave, that citizens' behavior is paramount. Their responsibility is paramount in trying to control the future, which can be very devastating if we don't control it now. Okay. So it is stressed again and again, and I think that's what you guys are also doing a great job of keeping the camera and the voices going. The social media is, sometimes spreads some irresponsible stuff, and we have to actually appeal to people to filter that out. There's no need to do panic buying. There is no, this is a very clever method of self-blackout, which is fantastic. I think it will help us to get the real value of, if we ever have to lock ourselves out, then this will be very valuable in that practice run.
Dr. Trehan, I'd like to see the air pollution counts in Delhi over the next couple of days. Maybe we might actually have a benefit out of this with cleaner air. But I want to go across to Dr. Dang as well.
Most definitely. It's already happening.
It is. Okay. You're quite right. It's bound to be happening.
Very much.
The traffic is so much less. I want to go across to Dr. Dang at this stage. Dr. Dang, you must be asked this question several times a day. Where's the cure? What's the answer to that?
There's no cure. The cure has already been answered. That cure is only social distancing. Cure is personal hygiene. Cure is management of patient who is unwell. And I'll again emphasize the point that cure is increasing the testing so that we do not reach stage 3. And as per the proposal which we have submitted to the government, it will be better if the samples are collected from home, the patients are refrained from coming to the labs, samples collected from home by trained personnel in proper viral transport media, which are transported to the lab, the testing performed, and the results delivered as soon as possible, so that even if we find a few patients who are suffering or who have contracted the disease, we can isolate them out. The worst case scenario can be that we test lots more than what is required, but so what?
Okay.
But even by testing more, at least we'll be picking up a few, and if those few are quarantined out, we'll prevent it from reaching stage 3. My appeal is that let's increase the quality, let's increase the number of testings immediately.
Okay. I want to go across also to Geeta Bhatt, who joins us, as does Sanjay Jha. Geeta, let me come to you first. Thomas Isaac, the Finance Minister of Kerala, has tweeted. He says, disappointed with the Prime Minister's address to the nation, very generous in words but stingy in deeds. Yes, citizenry will pay heeds to your words and stay indoors, but who will pay their food? What we need is an income transfer program, preferably declaration of a universal pension program. How would you react to that?
Well, Vishnuji, you see, there is in the Prime Minister's address, he has already talked about an economic response task force, which is going to look into the requirements of industry, and as well as of the people who are, especially those below poverty line. And I think the Kerala finance minister can take a cue from Uttar Pradesh, where the chief minister already, as a preemptive measure, has already constituted a committee to look into for providing of, how can financial aid can be provided to laborers and to the daily wages. So, the way we'll cross the bridge as it comes, the way it is important right now is that there has been a very, very positive message by the Prime Minister, and the kind of popularity and respect that he has among the masses. It is going to, drive the point home that it is very important for social distancing, and also the appeal for the Janata Curfew, which he has. I think that is something where he has asked that collectively we need to be, a responsible force, a moral force together, and see to it that we do not venture out, especially on a day where, since already people are working from home, and there has already been an advisory even for those who are in government service. Okay. In government service, they can, that they need to work from home. So in such a condition, it is something very natural that on a weekend people would like to come out. So I think that is one message that is going to be, and we'll see that it will definitely have a very positive message. Also, hello?
Yeah, Geeta, go ahead. Last point before I go to Sanjay, yes? Yes,
Vishnuji, and also very important is that his message where he has asked people to come out and pay their gratitude to those who are the Corona heroes, those who are the doctors, the nurses, and especially those who provide us essential services, who are going to be on their job in spite of the danger that is there, because no one knows from where it can come.
So that's an important step. I take the point you're mentioning. Sanjay, how would you react to what the Prime Minister has said? How would the Congress party react to what the Prime Minister has said?
Well, Vishnu, I mean, this is not the correct environment for a political brawl. And therefore, I first need to tell you what are the positives in the Prime Minister's speech to begin with. Number one, I definitely felt that he's not undermining or underestimating the extremely dangerous, diabolical scale of the coronavirus threat is highly welcome. There is no false reassurance. The Prime Minister bit the bullet and told the people of this country, we are in a high-risk zone and every day matters. That, I think, is highly welcome. The second important point that he made today was that to get the public participation in. There is no denying we are a vast country, a complex country, information is flowing in, but you also get a lot of rumors and there is a contradictory stream of narratives being created. To get the people in on board, I think that is always something in a democracy that we need to welcome. The third point, which is critical because, everybody talks about it day in and day out, is there going to be a crisis and an emergency and people should start hoarding essential commodities? And he said today that's not something you need to worry about. The government will ensure uninterrupted supply. Now, these are positives. The worrying for me were 2 points, Vishnu. One is that the government has to, on an urgent basis, and there was nothing tangible in the Prime Minister's speech, what are you going to do about people who live on a daily basis for their livelihood? And that is the bulk of India's informal, what we call as an informal sector. Now, they have already been devastated for a long time. Now, just take an example. I met somebody, I've tweeted about it. There's a guy next to my home who makes this Bombay sandwich. I asked him today, how much has your business been affected by? He said, I'm already down by 70% in the last 4 days. And he says, from tomorrow, I can't even come here. There's a fine of 3,000 rupees. What happens to this vast section? And I think given the fact that oil prices have crashed and the government has got some kind of a windfall, you need to really get the incomes into the hands of those through Jan Dhan accounts or whatever you want to do. Okay. The second point is, I am telling you this, job layoffs are happening widely across the entire corporate India. And I think it's important to send out a message when the government is bailing out Yes Bank and all that you need to give moratoriums on EMIs for any individual with house loans, auto loans, personal loans, because you need to give some kind of a waiver of financial relief to those people who are even in the organized sector. So I think the government needs to give tangible alternatives very quickly. I think
that these are all very valid points. And yes, the Prime Minister didn't get into the brass tacks of the economic proposals. Yeah. We'll have to wait for that. He said it is coming. We're also joined at this stage by Mr. T. Sundaraman, Global Coordinator of the People Health Movement. Mr. Sundaraman, if this was an exercise in getting people to stay indoors and on Sunday to almost compulsorily get people to stay indoors, do you believe that this is the Prime Minister, starting the process for what lies ahead, which will be a more rigid system of a lockdown?
I think the big point is that social distancing is necessary, but it is not sufficient. Starting the process this is one part of the process. To that extent, it's welcome. But the bigger part of the process is hospital preparedness, where a huge time of neglect over the last 4 years of public sector strengthening has left you extremely weak. You're on the brink on many of the already running overcapacity in many of these hospitals. And if this whole social distancing, one must understand, is a very incomplete strategy. It will delay the event. It will not completely avoid the event. You won't get the surge at one time, but you will get the surge spread over a particular time, and you need to prepare for it. Second, you need to prepare very urgently our entire testing ability. You can't fly blind, as people have been saying. You can't do social distancing for all times at all places. How long will you do it? After some time, the disease can come back again. You can't shut down indefinitely. It has to be very finite. And if you have to have a time limit, then you have to know very good information, quality information, as to where the spread is happening. And as the WHO Director General said yesterday, your focus has to be on isolate, test, treat, and trace. Every single case, not only the foreign return, because the spread will happen, even if it has not already happened. And there are real reasons to fear that it is already there. The scale of our testing does not rule it out. You must remember that the absence of evidence should not be with evidence of absence.
Sure.
See,
so lots of important points. Sure,
so
lots of important
the
points
point
there by.
Is that we are not seeing any signs of preparing for the actual next phase.
Just a last word to you, Dr. Dang. Would you like to reflect on that one point? I'm running short on time. That are we doing enough to prepare for the next stage? Because the sense right now is that we can hold it at level 2, which isn't community transmission. whereas a lot of people believe that community transmission is inevitable. What you're trying to really cut down on is massive community transmission. So my question is this: is community transmission still essential, inevitable, or can it be avoided altogether?
It can be avoided.
I don't see
At
the
least
possibility.
it can be decreased. No, it can be decreased only if we are taking more stringent steps, and one of them, as has been rightly pointed out, it is to increase the testing, see to it that people who are test positive are kept in isolation, and then only we have fast, rapid, accurate reporting, and isolation and management is the only key. We have to follow the South Korea model where lakhs and lakhs of patients were tested and isolated, and then only the plateau was reached. To prevent that, the plateau has to be reached, and the answer is only increased testing.
Okay, Geeta, last 30 seconds to you. You had a final comment to make. Yes.
Yeah, Vishnuji, while Dr. Dang has made, a comment which is important to be looked into, but at the same time, what about, the people who are all there on the streets, and in spite of it is an unprecedented situation in the country across the globe, and those who have been instigating, people like those who are at Shaheen Bagh and are refusing to move out, they are such a big danger, in spreading this disease. Why is it that, the civil rights activists and, other celebrities who have been going out and cheering them, themselves they are cooling off their heels at their home.
So I'm
but
not
why
sure,
can't they put a word of caution and tell them
I
and advise
agree,
them
and I think the Delhi
that
Chief
this is
Minister
really
has
a
said
very
quite
serious
clearly that
situation.
people shouldn't be allowed to assemble in that area in the present situation. But I think right now we are looking not just at Shaheen Bagh, which is a deeply political issue, but at what affects billions of people across the country. But what I'd like to thank all of you very much for joining us, because I have a small package to play out over here, an interview which I'd done earlier today on the issue of how patients are or suspected patients are in our hospitals. Now, should citizens who believe that they need to be tested for COVID-19 be sent to hospitals at all, as opposed to being tested in their own homes? At the moment, those who have some symptoms can be tested in hospitals, but here they are exposed to long lines where they can pick up the infection even if they don't necessarily have it. What's more, the condition in which suspected patients are kept in quarantine at hospital are often very poor. Results of the COVID test don't come for days. There are no shower facilities sometimes, and each isolation ward has several patients. Some may have the virus while others don't. Earlier today, I spoke to Professor Ajit Mishra, a citizen who went to Ram Manohar Lohia Hospital in Delhi to be tested, but has now been waiting for 3 days in an isolation ward for the results of his test to come back. Professor Mishra, when were you admitted into Ram Manohar Lohia and why?
I was admitted on 16th because I came in for a test since I had returned from London the previous day, and in the morning I had a mild temperature, so I wanted to get a test done. So I came to Ram Manohar Lohia in an ambulance. They took the sample, then they decided to admit me till the report is out. So that was 16th, just after lunch.
And 3 days, the result still isn't out. When do they say the result will come out for you?
They say they don't know. So, as and when they receive the report, they come and tell us, saying, okay, yours is clear or whatever it is. But there is no information about when it's going to come.
And what is your condition now? Do you still have symptoms, fever?
I don't have fever, ever since I was admitted, actually. Mm-hmm. And I think I took a, very highly, public-spirited precautionary move. And I could have, stayed at home for a couple of more days to check. So I haven't had any temperature, for the last 3 days.
And
or cough or anything.
Sure. Professor Mishra, what is the condition of the facilities around you?
It's the staff is very nice. I must begin with that. So, but facilities-wise, these are not meant to be isolation wards, because one room has 6 beds, with curtains. There's a common washroom. Doesn't have showering or bathing facilities. And the maintenance requires a little bit. For example, we don't have water supply today in the washroom. So for a mixture of patients who might be carrying different sorts of viruses, it's a little scary.
So no shower facilities for anybody in the quarantine, so nobody has bathed?
No, I think if I remember, the girls' wing, the girls' bathroom has some facility. In the men's, no, there isn't any. So I haven't had a shower or anything since 16th.
And all of the people who are kept over there, they are kept isolated. And so your big concern is that anybody can pick up the infection from somebody else, even if they are brought in without necessarily having an infection themselves.
That's right. That's precisely the point. Yeah.
And when you raise this with doctors, what do they say?
They say, you have to be careful. Yes, they do give us advice about, not touching your face and always wearing gloves, or, we are all been given those hand rubs.
Sure.
And tissues.
Right.
So that they provided, and we are always wearing masks.
Right. Well, Professor Mishra, thank you for speaking to us and giving us an idea of the situation there. Thanks very much indeed, sir.
Thank you. Thank you.